My case presentation for today is about syphilis. Mr. JK is 24 years old male who came to the outpatient clinic complaining of multiple asymptomatic erythematous raised scaly lesion in the body for 6 weeks. He also reported multiple patches of hair loss on the scalp, which started about a week ago. He stated that I was a completely healthy and active person before all this started 6 weeks ago. He added that the rash started as multiple pinhead-sized red raised lesions in the forehead, which started to increase rapidly in size within 1 to 2 days. He denies itching or oozing from the skin lesion. Similar lesions develop in the trunk, lower and upper limbs, including palm and sole 7 to 10 days after the first lesions. Then 5 weeks after the first lesion, he developed patches of hair loss not associated with itching, oozing, scaling, or burning sensation. He also developed an intermittent low-grade fever associated with fatigue, sore throat, muscle ache, loss of weight, and feeling tired in the last 1 to 2 weeks. He reported sexual activity sometimes unprotected with multiple sexual partners. The last sexual contact was 14 weeks ago. He denied drug or alcohol abuse. He reported that 2 weeks after his last unprotected sex, he developed a small button-sized lesion on his penis, not associated with pain, discharge, or bleeding. The lesion resolved by itself after about 4 weeks with residual scarring. On physical examination, the patient was alert and oriented. His blood pressure was 120/80, heart rate 85, respiratory rate 16, and the temperature 97.5. He was having lymphadenopathy in the cervical, axillary, and inguinal regions. On his scalp, he was having multiple discrete patches of non-scaling alopecia, generalized symmetric skin rash on the face, trunk, upper and lower limbs, including the palm and soles. In the mouth, he developed white-gray raised moist lesion on the soft palate. The patient also was having healed scar in the glans penis associated with erythema around the scar in the penis shaft. Based on the history and physical examination, the diagnosis was made as a secondary syphilis. The following blood test was ordered to confirm the diagnosis. The treponema test is a serological test used to detect the antibody to treponema pallidum protein. Non-treponema test is used to detect antibody direct against lipoidal antigen, damaged host cell, and possibly from treponema. These tests will confirm the diagnosis and will detect whether it is active. The patient was educated about the disease and the importance of avoiding unprotected sex. In addition to that, the patient was educated about penicillin as an effective treatment for secondary syphilis. Thank you for watching.